asthma symptoms can get worse at certain times of the year, especially for kids. And sudden weather changes can cause flare-ups, and that could trigger attacks as well. And as we head into the colder season, Dr. Vinitha Moopen from WellSpan Family and Pediatric Medicine at Rothville is here with some helpful tips for us to know. Good morning, Dr. Moopen. Thank you so much for being with us. We know we are getting into sick season, right? We're in the middle of flu season, all this kind of stuff. So talk a little bit about how asthma can impact all of the other viruses we have going around.
So asthma is a chronic inflammatory condition. It causes increased mucus production, decreased airway size, and then causes this wheezing, cough, and shortness of breath. One of the major triggers is viral infections. And then also, temperature changes, allergens in the air. So this is a really big time for asthma exacerbations.
I know whenever you bring the kiddo to the doctor, right, they always ask you, okay, are they wheezing? Right. So why is wheezing an indication of asthma?
So wheezing is just a sound that's produced because the airway is decreased in size and it's full of mucus and cells, inflammatory cells. So that kind of tells us that there may be an asthma issue going on. Also cough, shortness of breath, chest tightness, those are other things that will point us in that direction as well.
And how would you know if your kid does have asthma?
So your doctor's going to take a complete history and physical. How often do they have symptoms? What triggers them? If they're older than 5, they can have pulmonary function testing. If it's their first time, they should have a chest x-ray. Allergy testing is another big thing in this area that we should be doing for kids who present that way.
And that's around, like, when you can really start to diagnose, that's around 5 years old?
5 is for the pulmonary function testing. Allergy testing you can do much earlier.
And, for so many kids this time of year, a lot of the symptoms that you use to treat asthma is what you would also use, for any virus that you have around. So what are some things you can buy around your home just to help this time of year as well?
So, using a humidifier, just making sure that the allergens that that they're allergic to, that they're not getting exposed to. I can't tell you how many parents I know who have a child known to be allergic to a pet or something and still have the pet in the home. Like, we need to kind of step back, because the more you're exposed, the more your airway gets remodeled, and sometimes medication's not going to help. So if you know your child's allergic to something, please take it out of your home.
And what are some of the medications?
So there's usually, for short acting, there's inhalers that will open the airway size. There are, for kids who have more symptoms and longer issues, then you have to add like an inhaled steroid or an inhaled longer acting bronchodilator. Sometimes they need oral steroids, sometimes they need stronger allergy meds to help with symptoms.
I know we're also in the middle of RSV season too. One of the signs for RSV is watching your child's chest and how that breathing is coming in. Does asthma play a role with that? Does that make that worse as well?
So the virus can trigger asthma in children who are predisposed. RSV itself, we can't treat with asthma medications. It's not going to help. So if they have had it previously and then they get RSV, yes, that can trigger an exacerbation of asthma.
So definitely a busy time. A lot of parents a lot of things for parents to look out for, unfortunately, yes, when your kiddos are coming home sick. Yes. Well, Dr. Moopen, thank you always for being with us. And of course, if your child needs to be seen by a doctor at WellSpan, we have the information on how you can make an appointment. You can find it on fox43.com.